Hello, welcome to Dr. G Pediatrics. I am Dr. G. Today's question, I hope you guys find helpful. My child has a fever. Should I go to the emergency department? Okay, so I'm going to answer that question and also provide some tips about kind of what to do if your child does have a fever and what may be some signs that you should go to the emergency department. I get this question a lot. Not does my child has a fever, do they need to be seen? Do I need to come in? But my child has a fever, do I need to go to the emergency department? Most times the answer is no, because, well, a couple of reasons. Fever in itself does not mean emergency. Fever is your body's immune system defense to help fight infection, most of the time fight infection in the body. There are other causes of fever in children, which we're not discussing today, but when we're thinking about infection, it's your body's defense immune system doing what we want it to do, right? So your body building that fever or your child's building that fever is actually a good thing. So just because you have a fever or your child has a fever, doesn't mean that it means emergency. So most of the time, no, you don't have to go to the emergency department if your child has a fever. Well, then the question is, well, Dr. G, fever is 103. I need to go to the emergency department. I'm like, well, okay, wait a minute. 103 fever, or the height of the fever in itself, is not an indication to go to the emergency department, because certain viruses such as flu, roseola can cause high fevers. And that's not the reason in itself to go to the emergency department, because the purpose of the emergency department is to help stabilize emergent situations. I'm not saying your child doesn't need to be seen by a healthcare provider if they have a fever, but they likely don't need to be seen in the emergency department. So height of fever in itself is not an indication for your child to be evaluated in the emergency department. But I know you want a number. So I would say 105 fever, and you don't have access to go to your pediatrician or go to the urgent care, and it's the middle of the night and you're not going to be able to sleep, and it's 105 and it's not going down, and your baby seems miserable or your child seems miserable, that might be a reason. But again, it's not just the height of the fever that is of concern. Are they having a high fever and they're still kind of like playing Roblox or like doing like dance moves and like popping and like doing all this energetic things that you're like, but you have 105 fever. So that's one of the first things to kind of assess, or a tip to assess, or something that I ask if I'm on call and I get a call is, how is the child acting? Are they still energetic? Are they still playful? Are they still singing, "We don't talk about Bruno," no, like my children do over and over again? I mean, if they are doing these things and their temperature is 104, I'm going to say no. You don't need to go to the emergency department, because the emergency department is going to take a look at your child singing "We Don't Talk About Bruno" with 104 temperature and send you home to reevaluate with your pediatrician. I know, and you just paid that copay, okay? So it's not just the height of the fever, it's also how your child is acting with the fever. And so I would say that is one of the things that's important to assess, because if I have a child that has 102 fever and the parent is telling me that they are not wanting to move, their favorite show is on, and they're just not really speaking, they're not wanting to get off the couch, then that is an indication to go to the emergency department with that 102 temperature, because that child is what we call listless. They're not even getting excited, and young kids are pretty resilient, so even with the high fever, they are really going to try to truck it through. But if that child is not really wanting to even like get up off the couch, they're just so weak that they can't get up, they're not playing, they're not energetic, and they have 102, that's more an indication for that child to be evaluated in the emergency department. For things that will actually be emergent, right? So are they so weak because their blood sugar is low? You know, are they not wanting to get off the couch with the fever because they're not eating and so they're not drinking, and now we're concerned about them being dehydrated and they would benefit from fluids through the vein or IV fluids. So that would be an indication for a child to be seen in the emergency department. Another question is, okay, so I can't go to the emergency department. Why? Why can't I go to the emergency department and my child has 103 fever? Like, that's not normal. They're going to get brain damage. The fever is not going to give your child brain damage. And I understand that is a legitimate concern, but it's not going to give your child brain damage. And so the going to the emergency department for that or that concern, it's just, you know, not recommended. And also, because you bring your child to the emergency department, one of the big things doesn't mean that they're going to do any lab works or x-rays or testing, especially if it's a pediatric emergency department where that's all they manage. If a child comes in with a fever and they are not dehydrated and their vital signs are not out of whack, which is they'll check their breathing rate, their heart rate, their temperature, sometimes their oxygen levels. So if those things are not super off, and the fever just happened today or yesterday, the emergency department may not even do any type of further evaluation on your child. You're like, what? Yes, because again, the emergency department is for emergent things. And so some of these things that you would want to be tested may not be indicated. And it's something that your pediatrician can help work through, right? Strep throat, flu, COVID, urinary tract infection, some of those common infections, ear infections, some of those common things that can give fever in children can be managed outside of the emergency department. So the fever, because you're concerned about brain damage and you want this thorough workup, I mean, I can tell you this, that's not going to happen, but I know that probably parents are going to go anyway, and that's fine. I've had family members do that, and that's okay, because I understand the angst or the worry when your child has a fever. So I'm not making light of it. I'm just trying to give some insight as to kind of what the medical professionals are assessing or looking for when a child would need to really be seen in the emergency department or evaluated in the emergency department versus being evaluated somewhere else, like an urgent care center or an after hours center or their pediatrician's office in the morning. And so those are some reasons why I would say they don't need to be seen in person. I will say, and I don't know if the brain damage fever thing comes from something that we see sometimes called febrile seizures, and that is when the child, it's most common between 6 months to 6 years of life. We're not going to really get into this right now because that's not what the topic's for, and I think you guys might start worrying if I start talking about febrile seizures right now. But again, febrile seizures don't cause brain damage either, right? And so with that being said, though, if your child is having a seizure, if your child is having a febrile seizure, that is an indication to be seen in the emergency department. So if they have a fever and they start having a seizure, that equals febrile seizure. That's a reason to go to the emergency department. That's a legitimate reason to go. And so the other, yes, you definitely are going to the emergency department if you have a fever, is if you are a newborn, less than 3 months of age. I am going to say, and you have a fever, and it's in the middle of the night, and you cannot be seen, at least as a benchmark by your primary care doctor, then they need to be seen in the emergency department. Definitely within the first month of life. If I have a patient's parent who calls and the baby's only a couple of weeks old and the baby has a fever, don't even come into the office, go directly to the emergency department, because that is where serious bacterial infection can be happening with that baby. And that's super important, what we call a neonatal fever. So if your baby is a newborn and has a fever, disregard everything I said earlier in the video. You have to go to the emergency department for that reason. So Another indication for where you would want your child to be seen in the emergency department. So we discussed if they're having a seizure, if their temperature is 105, very high and it's not going down, and you're super concerned, that would be a legit, and there's no way of being seen, that's a legitimate reason. Or if they have fever and they are lethargic, not wanting to play, not wanting to eat, not getting off the bed, and they don't have access to their regular doctor because it's the middle of the night, that would be an indication. Or if you're concerned about dehydration, so they're not urinating, they haven't urinated since yesterday, or she's only had one wet diaper in a 24-hour period, those are signs that you should be seen in, that's definitely an indication to be seen in the emergency department. Or if your child has fever and like vomiting that will not stop, and there's like stomach acid, and you're concerned about them being dehydrated, definitely an indication. So there are situations in which you should bring your child to the emergency department because there are reasons. But the fever in itself is not the indication to go be seen at the emergency department. Because I was just about to start running through this whole list. That's not what this is about. Because I'm like, well, then what if I don't say this? And that's not what this video is about. This video is about, my child has 102 fever. Do I need to bring them to the emergency department? Most likely no. Right? We live in a time, luckily, where we have so many options and access to care. Most pediatricians have some type of on-call service. They can help talk you through if your child has a fever and kind of ask you questions. So you don't have to just like fever, press gas, go to the emergency department. You don't have to do that. You have resources, you have help. A lot of insurance companies now offer telehealth as a part of their insurance policy, and you may be able to, have that interaction in the middle of the night without having to be seen in the emergency department. So the resources there. If you're concerned, definitely understandable. You have a physician, I'm sure, that you can talk through those things with in the middle of the night if that happens. So where you don't feel like you have to go to the emergency department. So I hope I didn't scare parents. That wasn't the goal. But I hope I was able to kind of just talk through some of those things about when you probably don't have to go to the emergency department if your child has a fever. And I did touch on a few scenarios where that would be ideal. But though that was not an exhaustive list of when you should. I was more so focused on the reasons why you probably don't have to go to the emergency department if your child has a fever. So I hope you found this helpful, or maybe laughed at me a few times. Either way, I hope you guys subscribe or share or found it helpful or beneficial. Until next time, stay great and have an awesome day. Bye.